So you three have any ideas on what's ailing our patient?
Well, doctor, I believe it's a case of catarrh based on their recent travel history.
I beg to differ, Les. I think the symptoms point more towards post-vaccinal encephalitis.
And if we look closely at the ocular involvement, I'd say episcleritis is our best bet.
All right, kids, let me clear this up for you. Our patient has protothecosis.
What? How do you know that?
I thought we were discussing the symptoms first.
Well, what makes you so sure it's protothecosis, Dr. Hawks?
Because I'm not just a pretty face, all right?
Okay, so what does this mean for our patient?
Well, Leslie, that means you have to perform a wedge resection.
A wedge resection? Dr. Hawks, that's risky.
And why would we want to put the patient in danger just because of your hunch, Dr. Hawks?
Because I say so, Frank. Now you two get out there and break into that patient's house. Look for any signs of what ails them.
I'd really rather not, Dr. Hawks.
Don't worry, Randall. We'll be fine as long as they don't catch us.
And Randall, please make sure you don't get caught. As much as the budget is endless this year, I'm spending it on new doctors. Not old stupid ones I need to bail out again. I don't understand why you're questioning my decision, Tracy. I've been doing this for years, and I believe that a wedge resection is what's best for my patient.
And that's exactly the problem, Hawks. You've had wrong calls in the past, and it's your stubbornness to let go of them that worries me.
Those were just isolated incidents, Tracy. I assure you this time I am right.
Well, if you say so, Hawks. But remember, even a blind squirrel finds a nut once in a while.
That doesn't even sound like something you would say.
Sorry, I stole that line from your diary while you were sleeping last night.
Fuck! This is not going well at all. Why did I let Hawks convince me to perform a wedge resection on a patient suffering from protothecosis? It's obvious now that it was the wrong treatment choice for her. I should have trusted my instincts and not taken Hawks's advice so lightly. Now, our patient is in critical condition and we still don't know what to do to save her life. God damn it all, we need to find the right treatment for this poor woman before it's too late. We can't afford any more mistakes or delays.
Nothing. Absolutely nothing. What a waste of time.
I found some clues here in the home that are definitely related to protothecosis.
Like what?
There are ants crawling out of the toilet.
Great. Thanks for looking there of all places.
Dr. Hawks has been insistent on wedge resection being the correct treatment for this condition. However, based on the clues we found here, it seems like he might be wrong.
You're right. Let's go back and take another look at his research.
Exactly my thoughts. And as much as I hate to admit it, we might have committed a crime just to find ourselves with no real answers for this patient.
No shit.
Did you idiots nearly kill that patient? You have the gall to tell me what is and isn't relevant to protothecosis when your misdiagnosis led us down this godforsaken path of a wedge resection?
We were just trying to be thorough in our investigation.
It was only a slight error. We didn't mean for any harm to come to the patient.
Thorough my ass. You're all a bunch of idiots who should have your licenses revoked. You couldn't even care about the patient when you found out they were living in squalor, did you? You were more interested in patting yourselves on the back for discovering something irrelevant?
Squalor? Frank found ants in the toilet?
I was being ironic.
I think we can all agree that a misdiagnosis was made, but I'm not sure how that's entirely our fault.
Of course it is your fault. You're the ones who should know better. Now go tell Wedge to stop his surgery before you fuck up any further.
But Hawks...
Shut up. I'm not in the mood for your excuses.
What do you think we should be doing now, then?
I think you should all be ashamed of yourselves and start trying to find out what the actual diagnosis is before someone ends up dead on our tape.
Do you have any ideas on what it could be, Hawks?
Honestly, no. Off to lunch for me to figure that out. I heard your patients are doing well at the oncology department.
Yes, that's true. The new treatment protocol we've been using has shown promising results so far. We're seeing a significant improvement in patient outcomes.
That's great to hear. I'm sure you'll be able to help more people with this progress.
Thanks, Hawks. What about your case? You seem preoccupied.
Oh, it's complicated. I think I might have figured out what's wrong, though.
Really? Well, that's great. What is it?
I'll tell you later, Johnson. I need to take care of this first.
All right, no problem. but can't you share a hint or something?
No, it's probably not relevant to your cancer cases. I don't need your protective equipment. I've been in worse situations than an operating room.
God damn it. This isn't about you, Hawks. It's about the patient's health.
You can't just waltz in here like this. We have a procedure for everything, Hawks.
What's going on here? You're not even wearing gloves.
I know what I'm doing. Protothecosis was wrong. We got it down to microspherofachia now.
But how did you figure that out?
Did you even talk to the patient or review their medical history?
What's the prognosis for this microspherofachia of yours, Hawks?
The prognosis is dire. It's a life-threatening condition, but not hopeless.
And what exactly was your point in breaking into the patient's home again?
To gather evidence we were right, which you all failed to do properly.
We've been doing our job just fine, Hawks. Maybe you should break into homes and figure these cases out from now on.
Well, at least we know what not to do next time, thanks to your expertise.
Well, keep learning from me then. I'll be outside if anyone needs any help or wants to learn something new about our craft.
It's Minecraft.
Thanks, Captain Brainrot. You go play 3D Terraria while the adults play 4D chess with the tricky medical cases. God, you're such a pain. So I got the right diagnosis for the patient. Congrats to me.
That's great, Hawks. You've done a good job here.
Yeah, but it wouldn't have happened if my diagnostics team weren't so full of themselves.
Now wait a minute. You declared the wrong diagnosis yourself, not them.
Why are you shifting the blame?
Look, I'm just saying that having better doctors would help us avoid such embarrassing mistakes in future.
So now we're back to blaming the doctors again. Hawks, your behavior is just as stupid as your initial diagnosis.
I'm not the one breaking into patients' homes to figure out why their piss isn't yellow enough.
Was that a confession?
No, my piss is yellow.
That's not what I asked, smartass. Are your doctors breaking into homes again?
There's nothing wrong with that. It's probably not even a sin according to John.
Your little doctors are supposed to be helping patients, not cosplaying clingy missionaries who didn't score in college.
You really want our patients to go to hell, don't you?
Don't be ridiculous.
I'm not. There's literally a billboard on the side of this hospital now advertising that.
Wait, what? I swear, I told him that kind of proselytizing was not okay.
Yep, St. Duke is really going down the shitter. I'll take care of it.